Hi, my name is Andrew Page and I'm the Senior Surgical Oncology Fellow here at Hopkins.
And I'm Megan Winter. I'm the Junior Surgical Oncology Fellow at Hopkins.
Thanks to Jeff Copeland and the immixGroup Foundation for their continued support of Johns Hopkins. Since 2005, approximately $1 million have been raised and going towards Johns Hopkins and to the Surgical Oncology Fellowship.
Medical innovation and medical and surgical education require an incredible amount of resources. And Jeff Copeland and the immixGroup Foundation have been so generous in their donations to Johns Hopkins over the years. Their remarkable gifts to us have made, among other things, our own fellowships possible.
As the Senior Surgical Oncology Fellow, I've been provided multiple opportunities with the Foundation's funds this year. After just now completing my first year of fellowship, I was able to apply it in many clinical directions. I was very active clinically, both in terms of gastrointestinal and soft tissue and other types of tumors. But I was also able to create projects that I can create and build on for this year.
When I started my education, my goal was to earn my way into a position where, simultaneous with practicing surgery, I could examine the methods that we use to improve patient outcomes. The fellowship to me is one last burst, not only of focused clinical study of cancer, but also a protected period where I have the luxury to access all of the work going on at Hopkins and establish my credibility as an independent researcher for my next step.
With the generous funds provided by the immixGroup Foundation, I was able to work with some of the world's experts in pancreas and liver surgery last year. Because of those experiences, not only was I provided the opportunity to gain the world-class expertise that I would like to portray in my eventual clinical practice, but I was also able to see on two levels what I was really passionate about. First, one of those impassioned ideas I received was on the wards one day after operating on a variety of different patients. It was a Saturday afternoon, and there were approximately 5 different family members from 5 different families out in the hallways. They weren't with their patient family members, but they were actually just talking amongst themselves, all commiserating, sympathizing with each other. On that very personal level, I was able to appreciate the individual sympathies that patients could have for each other that I think is unique to cancer patients. Taken from those experiences and other experiences like them, I was also able to develop project ideas, and that's what I'm spending this year working on. In fact, I'm working with the Armstrong Institute here at Hopkins through the Surgical Oncology Division to develop enhanced recovery pathways for patients undergoing liver and pancreas surgery. With these pathways, I'm hoping, with the guidance of my mentors, to improve length of stay, improve patient-centered metrics, and overall have better patient outcomes.
This fellowship, which has been generously funded by Jeff Copeland and the immixGroup Foundation, is actually perfect for me. When I was in residency, I did a lot of clinical work in a group of patients with pre-malignant diseases of the pancreas. The aim was to look for predictors of malignancy and who should be subjected to surgery and who shouldn't. I also got a master's in biostatistics at my old institution, where I gained some beginning experience with methods like decision analysis and population database analysis, which helps us to decide how we should change surgical practice on a larger population or even global level to improve outcomes. At Johns Hopkins, with its proximity to the Bloomberg School of Public Health, I will be able to continue the coursework I started several years ago, and I have never met a group of people so dedicated to thinking creatively about curing cancer, but improving the ways that we operate on cancer and improving the ways that we take care of patients than at Johns Hopkins. And the surgeons, the radiologists, the oncologists, the pathologists, the gastroenterologists, all of them work together in multiple multidisciplinary conferences, which will be my model for my practice for the rest of my career.
In the near future, I hope to see myself in a very active clinical practice. with a focus on potentially liver and pancreas malignancies, I hope to keep at my core the oncology training I developed here at Hopkins. As an oncologist with surgical training, I also hope to challenge some of the metrics we continue to use for managing patients with cancer from both an oncological and surgical paradigm.
My goal for my ultimate practice is to balance complex surgical oncology in the clinic and also pair that with academic research in patient outcomes and decision analysis. This fellowship is my opportunity to gain the credibility that I'll need to obtain funding for that work, but more importantly, to form the relationships with clinicians and researchers at Johns Hopkins that will be instructive and a continual source of support for the rest of my clinical and academic career. I want to thank Jeff Copeland and the immixGroup Foundation again for their gift. The surgical oncology field is rare, and this is a very competitive fellowship, and without their generosity, I might not be here. And this is going to be the core of the rest of my career, and I'm going to have unparalleled opportunities at Johns Hopkins. And I just wanted to say thank you.
Thanks.